Hi, and welcome to the School Health Educators Podcast, where we discuss health education and how to best teach health ed in the K 12 setting. Hi, and welcome to the School Health Educators Podcast. I'm your host, Lori Reichel. October is Health Literacy Month. And if you were able to listen to the last episode of the School Health Educators Podcast, you learned about Shape America's National Health Education Council, as well as the health literacy resources that Shape America has on their website. The last episode, I had guests Adam Mullis, Lenny Parham, and Melissa Quigley all talk about, again, the council that they sit on, as well as some items that are available for Health Literacy Month. This episode is going to delve a little deeper to define what health literacy is. And I'm going to go over some examples that might help you recognize you actually know what health literacy is and we're doing it, but sometimes we need to put the pieces together a little bit more. So to begin, let me go to the Centers for Disease Control and Prevention website. They have a page that's titled Health Literacy. And I'm going to start sharing my screen for that in case you're able to watch this on the School Health Educators YouTube channel. Okay, so I just pulled up what is health literacy, and this was released on October 16th, 2024. And they actually have some definitions that were released with the Healthy People 2030 initiative, and they broke down health literacy to one of two things: personal health literacy or organizational health literacy. And I'm going to read how they read on the website right now. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy, that's the second one, is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So for us, working with the pre-K through 12 level, we really focus on personal health literacy. And putting it into my terms, it's basically helping young people obtain, learn, recognize age and developmentally functional health knowledge, so knowledge that's applicable to their lives, and being able to utilize that information to make healthy decisions for themselves, to be able to communicate their needs and wants in relationships. It's helping them figure out more of what's going to support their wellness. It's personal health literacy. And I also so if you do the three domains, the cognitive is that basic information that they need. The skill part is they're able to decide, access reliable resources, maybe analyze influences, manage their health. And then that affective is that it's important for them to actually make the best decision for themselves. That affective of, this is important. This is important for me. I matter. So when we're teaching, especially skill-based health education, it's supporting our young people's health literacy to do the best they can for their own wellness. I'm going to give a couple of examples. And one of my favorite ones deals with a product, because sometimes that tactile product helps young people apply decision-making or analyzing influences a little bit better. So many, many years ago, I was in a popular store in the Midwest, and it was a clothing store, and I was looking at their additional products on some shelves, and I came across this product, anti-monkey butt. So it's anti-monkey butt. It's a funny name to me. I had to check it out. I actually did choose to get one uh, because I wanted to use it in my classroom. And I also checked out the website for it, and it has. I thought it was like a funny product, like it wasn't real, but it is an actual real product. It's again anti-monkey butt powder with calamine powder in it. So, and if you went to the website, you would see that it's recommended to be put into areas that would have friction. So, specifically, if you're horseback riding or bicycling, truck driving, any place that you would have skin on skin contact where there'd be friction. Now, what's interesting is when I've asked young people, is this okay for everybody to use in here? And we can pass around the product. A few people actually catch that this isn't necessarily helpful to use if you're going to use it in any open area, like in your genital area. So if you were going to go horseback riding and you wanted to put it by your legs, some people, those of us with a vulva, wouldn't use this product. And the reason being is because it has talc in it. And the talc is not a healthy product to be placed into our vaginal area, the inner and outer labia. So it's not healthy. Also, there's a fragrance in here too, which we recommend not to have fragrances put around the vulva area. So there is another product that they have in a pink bottle. So we can then analyze the influence of the bottles and the stereotypical messages that were sent. Uh, but this is just one example of we can't just buy it and use it. You have to really do more research to make sure you're being a positive, health literate person. Okay, that's my one example for that. Another example, and it was really nice that we were given this at our university, and I carry it in my book bag. This is the overdose rescue kit. So, again, this is a physical example to demonstrate what is health literacy. So, basically, when you see these kits, and sometimes they're around areas, we actually have some in like a public places where unfortunately people have been found to have overdoses from certain substances that are taken into their bodies. But these kits are basically to help somebody be revived or become conscious again due to an overdose. In the kit, this is, if you're watching this, it's easy to see. If you're not watching it, basically, I just pulled out a Narcan nasal spray. And I have an expiration date, which is May 2026. So, and that's me exercising my health literacy because I'm looking to make sure it's even not an expired product. So it does show to peel here. I won't do that because I'm not using it. Yet there's an actual nasal spray. So if you're somebody that uses a nasal spray for allergies or something, it looks very comparable to that. What's interesting is in the directions, it does give you information about signs of overdose, and that's basically a person who's passed out or breathing very slowly. The lips are blue or grayish in color, and you can check for a response by shaking or shouting to the person to wake them up, or grinding your knuckles into their chest bone for 5 to 10 seconds. I don't know if everybody would feel comfortable to do that. The big thing here is to call 911 right away. If you choose to use the Narcan nasal spray, you need to know how to do it properly. And I would recommend if you have our Narcan kit, and again, it's labeled here as an overdose rescue kit, I recommend putting in gloves. I have gloves in my kit because I recognize sometimes if people are using drug equipment like needles to get high, they potentially might be sharing needles. They might have some germs that I personally don't want to have on my hands. And, sometimes we have a paper cut or, something from a nail that's bleeding. So I always recommend people to put in gloves before touching And we know that in first aid and CPR, so I don't have to defend myself here. We put on gloves before we touch people typically. So after you put on gloves, and if you're going to administer, you hold the Narcan nasal spray with the thumb on the bottom of the plunger and your fist and middle fingers on either side of I'm sorry, not your fist, your first and middle fingers on either side of the nozzle. And you'd have to tilt the person's head back that is overdosed and provide some support, and then gently insert the tip of the nozzle into their nostril. And you're going to press the plunger firmly to give a dose of the Narcan. And then you're going to remove the nasal spray from the nostril after giving the dose. You're also, after that, you're supposed to wait and watch the person closely. Now, as I said before, one of the most important things to do is to call 911 in these situations. That's me being a health literate person of, I'm not sure what to do, except let me call 911 in this situation of danger. That's a decision that's so important. Check, call, care. It's that check the situation, call 911, and then begin the care. So the care here would be choosing to use the Narcan overdose rescue kit. I will also say to you, another level of health literacy is if you're going to use this kit for somebody that has overdosed, we recommend that you step away from the individual. You can place their body and on their side, yet we also recognize the person might become very alert, might become angry because of the effect of the drug that they took is no longer giving them that high. So they're basically coming down from a high, if I say it like that, and they might not be a happy individual. So please make sure that you're in a safe spot for your own safety. So that's some information to help you become more health literate for using a Narcan. My third example, and it'll be the last for today, is practicing a breathing technique. There's so much research that talks about the positive impact of breathing techniques. I'll do a shout out for Healthy Minds. That's an app that I have on my phone. I'll make sure that I'm calling it the right thing. Yes, it is Healthy Minds. And I've been using that class. So it's for free. You can give a donation. I'm sure they love it. But it's a great resource for us to learn a variety of mindful or breathing techniques. And it's not just sitting in the quiet and listening to your breath. There's so many different techniques to use for a variety of reasons. So for health literacy, my last one here is to practice lazy 8 breathing. And I'm going to show a visual for the YouTube channel. And I'm using what's in the tactile tools for social emotional learning book. So that book, Tactile Tools for Social Emotional Learning, activities to help self-regulate with SEL, pre-K through 5. Actually, it's great for all ages, pre-K through 12. And for here, being a health literate person, that would mean that I recognize at certain points I'm feeling distressed or anxious. And how can I help resolve some of that anxiety is to try a breathing technique. So this is a way for me to get more centered or to calm down. Maybe I'm about to go talk to somebody I've been dating for a while about an important conversation because things are getting more serious, or maybe I'm about to break up with them or something like that, or maybe I'm going to talk to a parent or other guardian about something that occurred. So I can try this breathing technique to calm down before I have the conversation. So this is a self-management tool, standard 7. So basically, and I'm doing it backwards here because I'm trying to model it in the video. Basically what you do, it's a figure 8 that's on its side. So it's a lazy 8. And you put your finger on where the 1 is, and then you take an inhale as you slowly move your finger on this pathway, and then you exhale. And I'm not reading it correctly, so let me redo that again. So if I'm starting here, I inhale, I see that word. Exhale. Inhale. Exhale. Inhale. Exhale. And it's funny, I even slowed down as I'm modeling it because the more you do it, you typically will slow down a little bit. So that is me being a health literate person by choosing to use a breathing technique to relax before I have to have a conversation with someone. So self-management. Other examples are if I'm prescribed medication, I would follow the directions appropriately, making sure that the substance I'm being given, the prescription, is right for my body. If I'm having any issues, that I would call up my medical professional as quickly as possible, that I'm not taking other people's prescription medicine. Also, over-the-counter medicine, I am very cautious. I read the directions. If I'm a young person, I ask for an adult to make sure that I'm allowed to take it. It's best for my body. For substances, that things are used properly, et cetera, et cetera, et cetera. So we want to make sure that our young people are as health literate as possible, as well as adults. Hopefully, all of us are following directions for things and applying it to our lives. And I hope that this helped clear up some things, this episode about what health literacy is. Again, it's about having age and developmentally information that if I'm a young person, I know that information so I can use it and make decisions for my own life or for others' lives. So it's applying the information to one's own life by best decision making and communicating effectively, analyzing influences. So, yeah, maybe the best summary for this episode is to say health literacy is about having healthy habits because you know the appropriate information and you know how to perform the healthy habit because of that information and that you care about it, the affective. How's that for a summary? With that, I thank you for listening in to today's episode. Please give us a thumbs up, 5 stars. That'd be great. And remember to check out the schoolhealtheducators.org website if you haven't yet. And last but never least, thank you for doing what you're doing. The children need us. So thank you for doing what you're doing. And I hope you have a great day. Bye.